Hello, everyone. My name is Kayla Knight, and I'm going to be speaking about non speech oral motor exercises. All right, so let's go ahead and jump right in. Non speech oral motor exercises are targeted to strengthen the craniofacial muscles used for articulation. They're used to influence articulation and speaking abilities, but they don't require production of speech sounds. So essentially, non speech oral motor exercises are oral exercises that focus on movement of the articulators. And when we think about articulators, we're talking about the tongue, the lips, the jaw, and anything that's involved in production of speech sound. This type of motor training has been used to influence articulation and speaking abilities. However, there's no actual speech production involved. Non-speech oral motor exercises have been used as an intervention technique for children with speech sound disorders. A survey conducted in North America and the United Kingdom revealed that many speech language pathologists utilize these techniques on a regular basis. In this particular article, the authors conducted an additional study among speech language pathologists in India, and they found that 91% of the speech language pathologists claimed to have used non speech or motor exercises in the past or use them currently. Previous research claimed that non speech or motor exercises was effective. However, there is a controversy around the implementation of these practices today. So, non speech oral motor exercises are exercises that focus on movement of the mouth to strengthen the articulators for speech production. So, some examples I have here are sticking out your tongue, blowing, puckering your lips, tongue curling, biting, and chewing. Essentially, with non speech oral motor exercises, it's any repetitive movement that's done in an attempt to strengthen the articulators. So, some reported benefits of implementing non speech oral motor exercises have been an increased awareness of the articulators, increased strength in the tongue and the lips, and jaw stabilization. Some populations that have been claimed to benefit from implementing non-speech oral motor exercises are patients with dysarthria, childhood apraxia of speech, speech sound disorders, patients who are hearing impaired, and patients who have had a cleft lip or cleft palate. So here's an example of non-speech oral motor exercises. So here are some reported benefits as to why you should implement non-speech oral motor exercises. One claim is that oral motor exercises can benefit adults with conditions like neurological problems, speech disorders, physical disabilities, and dyspraxia. Another claim is that these exercises are effective for adults and children. So, for example, children with childhood apraxia of speech. Another claim is that non speech oral motor exercises can help improve the coordination in those oral muscles used for speech and sound production. So, overall, the implementation of non speech oral motor exercises is controversial. Although there are claimed benefits, and there has been information that claims specific groups of people benefit from implementing non speech oral motor exercises, there's a significant amount of evidence that shows them to be ineffective. There's also a gap in evidence based research that shows a direct correlation between the use of non speech oral motor exercises and improvement. It's also been noted that the area of the brain that controls articulation is not the same area that oversees non speech movements. So, here's some additional information that refutes the implementation of non speech oral motor exercises. There's no research that shows us that it's necessary to warm up our mouth. So we don't have to practice doing tongue wags or poking out our lips several times before we're able to produce sounds. It's also important to note that there's no proven correlation between being able to complete non-speech oral motor exercises and the ability to accurately produce sounds. So what that means is just because a client can produce those non-speech motor movements does not mean that they will be successful in accurately producing speech sounds. In this particular study, the author specifically focused on using non-speech oral motor exercises in treating children with velopharyngeal dysfunction as a result of cleft palate. And after reviewing the literature, they determined that there is no evidence that supports the implementation of non-speech oral motor exercises for improving articulation abilities in children with cleft palate. It's also important to note that previous research that supports the implementation of non-speech oral motor exercises have a low level of evidence because they lack randomized control trials and they're outdated. In a survey that was conducted in 2015, out of 127 participants, 91% of SLPs claimed that they have used non-speech oral motor exercises with clients. That's about 115 of those participants claim that they have implemented the use of non-speech oral motor exercises. In a more recent survey in 2018, 85% of speech language pathologists reported using non-speech oral motor exercises to change speech sounds specifically. So again, this is an extremely controversial topic because regardless of the numerous articles that completely refute the implementation of such practices, there's still speech language pathologists that are implementing such practices. So we have to ask ourselves, are speech language pathologists prioritizing evidence-based practice? Evidence-based practice should guide speech language pathologists in their clinical decision making. This is a huge ethical dilemma within the field because it poses the question of whether SLPs are prioritizing evidence-based practices rather than relying on their own knowledge. It's so important to utilize peer-reviewed evidence-based research to make clinical decisions. Evidence-based practice is important because it ensures that the clients are receiving a high quality of intervention that is effective in improving patient outcomes. So, as far as my personal recommendations, considering the information that we just reviewed and the current research relating to this topic, it's not best practice to implement non-speech oral motor exercises to treat patients with speech sound disorders. There's a lack of concrete evidence that support the use of such interventions. Additional research is warranted to clarify so much conflicting information. In 2018, Gregory Loft stated that if clinicians want speech to improve, they must work on speech and not things that look like they're working on speech. So, although this is somewhat of a controversial topic, I really want to emphasize that speech language pathologists have to prioritize evidence-based practice. Evidence-based practice needs to guide clinical decision making. Every patient deserves high quality service, and in order to ensure that, speech language pathologists need to make sure that they're implementing effective intervention targets that can be supported through the use of evidence and research. All right, so this concludes my presentation on non-speech oral motor exercises. If anyone has any questions, please feel free to comment them on the forum below, and I'll be more than happy to share with you some of the information that I found. All right, thank you.